The dangers of early sexual debut. Today, young people start sexual life earlier than their parents a generation, so the timely formation of sexual culture is important. Research on the state of reproductive health of youth conducted by domestic scientists in recent years, with the support of the UNICEF Representative Office has the following results of pupils of grades 9-11 and university students were interviewed. 24.3% of respondents reported having sexual experience from 6.3 among 13-year-olds to 44.6 among 17-year-olds. Boys more often than girls of the same age indicate the experience of sexual relations in all age groups. More than half of the boys of 54.9 and every third girl 33.9 recognized their sexual debut before reaching the age of 17, i.e., having their first sexual contact. 73.1% of respondents reported using a condom during the last intercourse. 17.1% of respondents practice interruption of sexual intercourse as a means of contraception. Number of abortions has slightly decreased in recent years, and the contingent of girls who wish to undergo this procedure ranges from 15 to 19 years old. Dangerous consequences of early sexual debut in teenage pregnancy, mental trauma, STDs, and infertility. Teenage pregnancy. Pregnancy at an early age can threaten health and sometimes life. The probability of stillbirth and newborn mortality among teenage mothers is 1.5 times higher than among women aged 20 to 29. In addition, the risk of maternal mortality is extremely high. The impossibility of completing schooling, obtaining an education, and a profession limits opportunities for obtaining a well-paid job, leads to a low level of income and a decrease in the standard of living of the mother and the newborn. A young mother who does not work due to the need to take care of a baby falls into long-term financial dependence on parents or other people who can put pressure on her. There is a high probability of condemnation from relatives and the risk of raising a child alone. Mental injuries. Early pregnancy is a strong stress not only from the point of view of physiology, but also such that it will affect the psychological state and sexual relations in the future. This is fear of parents, and fear of being alone if the guy stays away from her problems, and uncertainty about the future. Abortion is a complex psychological and medical problem. Statistics claim that 25% of women have difficulty conceiving or carrying a child after their first abortion. STDs is sexually transmitted infections of early onset of sexual life, frequent change of partners, irregular use of a condom during sexual contact, sexual intercourse under the influence of psychoactive substances are the reasons for the most common risk of STD infection. To date, more than 30 types of such infections have been identified. Most often they are latent for a long time, that is, without clinical manifestations, affecting the reproductive system of young women and young men. The most common STDs are urogenital trichomonations, gonorrhea, chlamydia, uroplasmosis, hepatitis C, and HIV are the most dangerous not only for the reproductive system, but also for the whole body and even life. Girls are more prone to infection than boys. It has been proven that certain types of human papillomavirus can later cause cervical cancer. This infection is transmitted not only during sexual intercourse, but also during skin-to-skin contact, so a condom does not guarantee full protection. Infection with many STDs has unexpressed symptoms, which increases the risk of transitioning into chronic forms. In the case of self-treatment, significant complications are possible. If there is a suspicion of STD infection, you should urgently contact a qualified medical specialist and be sure to undergo an examination. Infertility, early sexual life, STDs, and as a result, chronic diseases of the reproductive system negatively affect reproductive health. Therefore, the smaller the number of sexual partners, the lower the probability of infection with various infections and the lower the probability of infertility. A condom is considered the ideal contraceptive for young people and adolescents. Simple and convenient to use, it can always be put in a purse or jeans pocket and used at the right moment. It protects against unwanted pregnancy and sexually transmitted diseases, but does not guarantee a 100% result because there is always a risk of its incorrect use, poor quality, or damage to integrity. Therefore, it is better to refrain from the early initiation of sexual relations until the time when you can be responsible for your actions. You should start talking about intimate relationships between a man and a woman to your child at the age of 9 to 10. Gradually providing information in small portions for comprehension. Do not be afraid to talk to your own child about sex, because who better than caring parents will be able to understand and help. not the internet, not television, and not fashion magazines. Remember, informed means protected.